Many recent studies show mental and behavioral health issues are rising across the U.S. Experts argue it's time to treat them as preventative care, just like heart disease or diabetes.
So we have 9 News mental health expert Cheryl Ziegler, Dr. Ziegler, joining us here this morning to talk more about this. So we'll get right to the question. Why are the experts now saying that preventative care has to involve behavioral health and mental health?
Because we are continuing to see the rise in mental health issues. So this is a huge burden on a healthcare system and our communities as well. So we had different reasons it was a slow climb, right? Then the pandemic of 2020 happened. Then it was really a collapse of the mental health system. And now that we're at 2026, things are not improving. And really the stats in many areas, particularly in youth mental health, continue to actually get worse. So it's time for us to not just say, what are the programs we're going to do to respond to this, but how are we actually going to prevent this from happening?
What does prevention look like for mental health and addiction?
So it looks like a lot of different kind of educational programs. So we know the most at-risk populations. So you can identify those populations. You can really target them, provide them with education, provide them with ongoing kind of resources for not just one person. Like if you're looking at a family, you can't just target one person and say, oh, we're going to focus on kids. That's not going to work. You need to focus on parents. So that could be parenting classes. That could be really providing the kinds of things that we know help, particularly like if you look at addictions, we know that there are certain things that are very helpful. And a lot of this has to do with talking about it, destigmatizing, providing stress management tools that we could do for much, much less than we do when we have to actually treat then the disorders that happen if somebody goes down the road of addiction or a deep depression.
Mm-hmm.
The topics you bring to the table here always have a timeliness to them. So why is this a topic right now?
Well, I think right now, as we're looking at where the administration is, taking their money, putting money, allocating sources, we have communities all around the country in which mental health resources are being cut. And so we're sort of saying, like, not only should they not really be cut, but really be thoughtful about how you use them. And really the thought, and this is not new data, the thought has been, if you can focus on prevention, that has a positive impact, not just first and foremost on communities and families, but also on our budgets. Mm-hmm. To treat is much more expensive than to prevent.
That kind of leads us into this next question about what role the federal government should play when it talks about preventative care.
Yeah, I mean, I'm sure there could be lots of opinions on this. My opinion would be on this is whatever systems we can get, that would be the largest system, whatever systems we can get to support the idea of prevention are positive. So if the federal government, who has obviously the largest budget, could say, okay, we are actually going to allocate money and we are going to focus on prevention and the research behind it. You have to follow the numbers, right? So you don't want to do something and then say, well, we're not exactly sure. You need solid research behind it. I think that would be, of course, the biggest bang for our buck in terms of the amount of money. But we have communities that do this on smaller scales. So to me, the federal government actually taking the time to talk about it in ways that we have done heart disease and things like that could be really probably nothing but positive.
How about last question, a look into the future. How could prevention change the way healthcare works in the future, mental health care?
Yeah, well, I think a lot of different ways. I mean, I think we can use the telehealth systems a lot better because if we're not dealing with a crisis, right, that's not a great place doing telehealth with somebody who could be anywhere to focus on crises. But if you can have things where, okay, you're not in a crisis point, there's a little bit of a problem, you can use technology in different ways. And we don't have to worry so much about the way people are using right now AI, because that's a huge concern. If you're in a crisis, you have a major problem, we don't really want people going there. Mm-hmm. So I think it allows where we see the future going, which has a lot to do with technology, that becomes a lot more viable when we are focusing on person-to-person prevention and even being able to use some of those resources at that level.
Yeah, very interesting. Dr. Ziegler, really appreciate you coming in.
Thank you.